my name is Christina, and we're going to go ahead and talk about the basic signs and symptoms of an infection in a wound. So I wanted to say the first thing to do is to gather all your supplies. So what we got here is we got some hand sanitizer. If you were in a medical setting, you would use hand soap. You'd naturally dry and wash your hands. That would be to the tune of happy birthday. We got some gloves, we got medical scissors, we got the disposable pads. We would get consent if we needed to get consent for any sort of minor procedure. We have the doctor's order, a throwaway ruler, a camera, trash can, any new dressings, and patient identification label to make sure that it's the correct patient. So the first thing I would do would be introduce myself. Hello, my name's Christina. I'm going to be the nurse taking care of your wound today. We're going to take a look at it and go over the signs and symptoms of whether it's infected or not, so you understand what to look for in the future. Alrighty, I see you're already sitting. I'm just going to put a chair here in front so we can make it a little bit easier for you. Let me go ahead and wash my hands. Okay, so we would wash our hands nice and clean. Put some gloves on. So first thing I'm going to do is put a pad down here so that your area is nice and clean. We're going to raise your foot up. Put your foot up on this here so we can take a look at it. Now, when did you notice this wound started coming into play?
15 days ago.
15 days ago. And did you notice that it's gotten worse in the time that you've had it?
Yes, ma'am.
Okay, we're going to go ahead and throw that down. So we do see here now that that we're going to go through the steps, okay? So I'm going to teach you what to look for in the event that this gets worse, and in the event that you get a wound in the future, and just to know when to come and see the doctor so that it doesn't get to this point, okay? So the first thing we're going to talk about is pain. Is there any pain in your wound? Do you notice, is there tenderness in this area?
Yes, ma'am.
Okay. Has the pain gotten worse since the wound first came?
Yes.
Okay. Do you notice any time that it gets more worse than other times?
When I walk around on it.
Okay. Do you notice that it's deep inside? Have you seen any kind of streaking or the pain coming around the area more?
Yes.
So it's kind of, but is it up your leg or is it just kind of in the local area?
It stays in my foot area.
Okay. And then the next thing we're going to look at is the redness in your wound. Okay, so we see some redness here, and I'm sure that you understand that a little bit of redness is common, but when it starts spreading bigger, that's when we really, really want to pay attention to it and go get some medical help. So with the redness, did you notice, it's around your immediate wound, but have you noticed that it's gotten bigger since you first got the wound?
Yes.
Okay. And have you noticed any kind of redness going up your leg at all, or down your foot at all?
Down my foot.
Down your foot. So, but it's more not like a streak, it's more just kind of like a circling area that's getting bigger, correct?
Yes.
Okay. And then the next thing we're going to look at is the swelling. So I noticed that you have some swelling all along the edge of the wound here, correct?
Yes.
And my thing is do you notice that the swelling kind of goes around a little bit more? Does it seem a little bit more watery at times?
Yeah.
Okay. And then the next step that we're going to look at is heat. I do feel that there's some warmth in here in your wound. Do you notice that the warmth has, as far as the area that the warmth is at, has it increased, has it spread?
It's radiated, yeah.
It's kind of going into more down into your foot. I know it's not as warm down here, but it's definitely warm here and kind of around. So it's a good thing you came to the doctors. And then drainage. I do see some drainage coming out right here. Do you notice that the drainage, what color is it?
It's a pinkish red.
Okay, so it's kind of approaching effect. You can see the yellow around the wound. The one thing we don't want it to get to where it's just clear, pussy drainage. So the doctor's probably going to put you on some antibiotics, and we got some orders here to take care of your wound. We're going to go ahead and do that, okay?
Okay.
One of the things you said you've had this wound for 15 days?
Yes.
Okay, so one of the things, most wounds heal within 7 days. And because you're saying your wound has, at a 15-day point, that means you're having some delayed healing, which is another sign of definitely an infection taking place, okay? So it's a good thing you came in. Definitely, definitely, because most wounds are already going through that process of starting to heal at this point. This one's definitely got some infection in it, okay? We're going to go ahead and follow the doctor's orders right here. We're just going to clean your wound really good. So typically this would be just cleaning the wound. This is what we have, a wound cleanser. This is contraindicated in some wounds, so if you're going to use Santyl or any kind of debridement, which might get to that point with a doctor, with the yellow right here, a doctor might give you an order, then you wouldn't use this because this is contraindicated. And you would take a couple gauzes and you would clean up that wound really good, make sure you don't leave any, and you're just going to tap it. Patient's already in pain. Trap your hands back here. Tap it some more. Okay, and then we're going to tap it again. Make sure it's nice and dry for her. Are you okay, ma'am?
Yes.
Okay. And according to the doctor's order, what he wants us to do is, because it's got that drainage coming out, he wants us to go ahead and use some Prisma. So I'm going to gather my Prisma. I'm going to gather my scissors. Now with Prisma, it's a little goes a long way. You definitely want to make sure that you, oh, I'm sorry. Let's rewind just a step, okay? What we would do is after we clean this, we're going to go ahead and take this dirty one out. Take our dirty gloves off. We're going to create a new clean field now. So we're going to go ahead and put down, because we're making sure that from this point everything's going to be clean. So we're going to go ahead and put this down. We've cleaned the wound. I'm going to put some new gloves on. Okay, we got some new gloves. Now we would go ahead and follow the doctor's order step by step. Can you tell me your name and date of birth, ma'am?
Richard Mendoza.
Go ahead and tell me your name, that's fine. It's going to, okay. Richard Mendoza, and what's your date of birth? I see that it's 1/1966. Is that you?
Yes.
Okay. Alrighty, so for the doctor's orders, we're probably going to want to take down some measurements here. We're looking at, you want to go from the edge of one side to the edge of the other, so you're kind of looking at about 4.2 there, and you always want to measure both sides, so you're looking at 2.7 there. On this ruler, you would put the patient's name, date, and you would write it all right here. And then, if you needed to, doctor's orders, he's going to watch the wound as it progresses. You would take some pictures, those would be uploaded, and you would erase those. Those would go straight into the patient's folder. Okay, so now we're going to go ahead and take this Prisma out here. And this is a very, again, a little goes a long way, so you want to try to make sure that you cut it as close to the, you just want to place it in the wound bed. So, let's go ahead and try to make this circle here. And it doesn't have to be exact science, you don't have to cut it 100%. You can kind of just place it in there. And this stuff is good. You can send the patient home with some supplies if you need. Again, this stuff is really good, so you want to try to keep as much as possible. So then we're going to go ahead and take a fresh gauze here. Put it over this is going to absorb all the moisture and promote healing. We're going to take a fresh gauze here. And we're going to go ahead and apply it over the wound here, just to try to keep everything nice and in place. Okay, doctor's ordered some gauze wrapping, some Mediport tape, and some burn netting. Go ahead and lift your foot up a little there, ma'am. So we're just going to put a little bit around, just to make sure that everything stays in place. Okay. So, ma'am, what you want to pay attention to after we're done here, we're going to make sure we definitely, you keep an eye on the wound from now on. We're going to send you home with some supplies to make sure that you can take care of it home by yourself. Do you have anybody that's at home with you?
No.
Nobody at home with you. Okay, so that's something we're going to need to address. Either the doctor can arrange for you to come back into the clinic periodically throughout the week, how many ever times he's ordered for the dressings to be changed, or maybe possibly home health nurse. So we'll just see what the doctor wants to do and what your insurance allows. So we got the burn netting in place. And then you definitely want to make sure that you're wearing some comfortable shoes over this. You don't want to have anything that's going to create any kind of pressure. You want this wound to heal. And as much as you can stay off your feet, you definitely want to stay off your feet. Okay, so we're going to go ahead and trash that. I'm going to go ahead and put your pants back down, ma'am. Alrighty. So then we would put her shoe back on. We would make sure everything's nice and good. Again, if she needed to readdress the type of shoes she's wearing, she would definitely do that at this point. And then we were just going to clean up all the dirty area, everything that's dirty. And then we're going to talk a little bit about, so we're going to, just like we were saying, we're going to make sure, I would wash my hands now. Hand sanitizer. Okay, so we want to make sure that you have your supplies. We're going to make sure you have your supplies at home. We're going to make sure we have appointments for you to come back. Doctor wants to keep an eye on it and see how that's progressing. He's probably going to put you on some antibiotics. I did hear him mentioning that, definitely. And also, either you would get a home health nurse that would kind of take an eye on that, or you would come back here. Alrighty. Any questions for you, ma'am?
No.
Alrighty. Thank you.